We're live.
Hi everyone, it's Danielle with Dr. Emer's office. I want to take a moment to show you part of our treatment, give you a little bit of education on some really cool things that we're using, things that we're doing, and the progress that our patient has been seeing with using with undergoing treatment. So the first thing I want to show is that she's using ProNox. This is something that we offer in our office as a basically like a pain relief device. And what it is it's nitrogen and oxygen, and it's like laughing gas almost. So it's very calming, kind of gives you a little bit of lightheadedness to take some of the discomfort away from a treatment. We're using that because we're doing Fractora and a combination of other treatments. It could sometimes be a little bit uncomfortable. So ProNox is something that you can use in office, and unlike pain pills or medication, you can actually leave the office and drive home. So it's a really nice alternative as pain relief. So we like that. The other thing is that I want to show you that we've done some TCA spots. I'm going to turn your head to the left all the way. Perfect. So there's two things going on here that I want to show you. First, we did Aerolase, which is a micropulse YAG, great for pigmentation, safe for all skin types, and addresses hyperpigmentation, acne. It addresses anti-aging, kind of whatever your skincare concern is to any skin type. Aerolase is really good for it. So we did Aerolase all over for all of those above concerns. And then you can see that we have some red, a little bit of swelling, and these little white pinpoint spots. This is from TCA Cross. So TCA Cross, we use, depending on the skin type and the concern, 50 or 70%. Great for ice pick scars. So these are good for those little scars. You can see right in here that they cause shadows even when the skin is pulled nice and tight. They're like little enlarged pores. And the way that TCA Cross works is it imposes a small scab, and this scab is eventually going to flake off, but what it does is it grabs on the edges of that enlarged pore, little circle scar, and it pulls them closer together. So you do need to do multiple treatments. Some patients see a really nice result with even just one, but you're looking typically at 4 to 10 treatments. So that's what all these little spots are. That's TCA Cross. So very normal skin response, swelling, redness, that's perfect. That white will fade into a small scab, flake off in about a week. The other thing that you're noticing here, her forehead is really consistently red all over. This is where I'm going to turn you a tiny little bit. There's no gaps. It's really even. There's a little bit of swelling and some pinpoint bleeding. This is from Fractora. So Fractora is one of our favorite radiofrequency microneedling treatments. So you can see here, has these coupling prongs. These small pins get pushed into the skin. They release energy into the deep dermis. Great for skin tightening, great for shrinking oil glands, awesome for people with acne scars, or want some skin tightening as a means of anti-aging. So this is the part that has already been treated with Fractora, and you can see here around the eyes, I got really close, we want to prevent those crow's feet, and you see pinpoint swelling. So very, very small little circular swelling in this area where these needles have actually gone in, so you can see that as well. So I just want to show you all these different steps of our treatment and how they work together and what we do first. So had our TCA, and now I'm going to keep treating over this area. So go ahead and take a couple deep breaths with the ProNox. So ProNox is cool because it regulates your breathing, and it gives you, it's fully controlled by the patient. So when they feel like they need a little bit of that relief from the discomfort, they can take a few deep breaths in and out through the same tube. Good for giving you a nice even, I'm going to get started, even smooth breathing. And it's, she can use as much or as little as she needs. And of course we did topical numbing, but the RF needling, it's so good and it is strong, so it can be a little bit uncomfortable. Every patient's different, but we go higher and higher on her energy every time. So what's neat about this microneedling treatment is it is safe for all skin types. These are coated needles, so each needle that's on the end of this handpiece is coated with gold. And what that does is it spares the surface of the skin and it minimizes the risk of pigmentation. So it's nice to have treatments that can address acne and anti-aging and scarring for every skin type. We didn't have that for a while where there was a lot of risk involved. So now what we do is we combine these with really good brightening skincare. How are you doing? Okay? Mm-hmm. Great. We combine it with brightening skincare or good brightening peels or pigment suppression peels like Cosmelon. And Cosmelon MD is one of our strongest depigmentation peels. We're actually going to be using that peel today on top of everything we do. So it's going to be really strong, all these little needles are creating micro channels that peel is going to get absorbed into the skin even better. And what's nice about doing a combo therapy like this, she comes from pretty far away. So we want to get as much in as possible. It's safe. We're targeting different concerns. We're targeting different depths of the skin, but all her downtime is going to happen at once. And it'll be wonderful. So the first time around that she was here, we did the similar combo treatment and took her skin that was breaking out, very cystic and inflamed and irritated, and we cleared it in 14 days. And it has now been looking better than ever. She's following our skincare protocols, and she was telling me earlier, she's very regimented and she follows all the steps consistently every single day, and everyone is noticing how much smoother and more youthful her skin is looking, and that's a great feeling. And so we're going to maintain that.
How many treatment sessions has this patient gone through?
So we've done, in the 3 weeks she was here last time from out of town, I believe we did 2, so we did Cosmetic to start with Fractora, and we ended up doing either 1 or 2 TCA treatments. I think maybe just one. One TCA treatment. We allowed that to heal for a couple weeks, for 2 weeks, and then right before she left town, we repeated the Fractora treatment with erbium. Did we put Cosmetic on at that time, or did we wait? We did later, or we did?
We did at the end.
We did at the end, so we applied another Cosmetic and went through another peeling process. So she's had 2 treatments, though they were close together, and then this is technically the 3rd. But her skin has had monumental changes, went from being very inflamed, cystic, almost even infected in some of those areas, and your skin goes through major changes, especially as women with hormone changes every decade. You're looking at potential skin problems that you never had before. And so it's important to address those as they come, find the root cause and see what you can do. The worst thing that you could do is leave an issue to where it causes scarring. And so we only have these tiny little bits of pigment left, and it's been great. So you can see all those little bumpy, swollen spots. Looks just like the tip of our handpiece right here. You can see that's a great clinical endpoint. I'm super happy. We're going to turn all the way to the other side. And you can compare the untreated. Here's our TCA. Here's where we've treated already. And we're just going to continue through. So I'm going to start right around here by your eye. Are there any questions about this treatment that we're doing? Any at all?
Will this help with sunburn?
No. So an active sunburn just requires soothing and hydration. Best thing in the world is to avoid the sunburn. Probably if I had to live with 2 skincare products for my whole life, I always say this, it would be retinol and sunscreen. The sun is the most damaging element that you can expose your skin to. Not just lines and wrinkles, but skin cancer. You know, it can cause so many problems, and some of those problems can be fatal, so it's important to really protect yourself. Now, things that the damage that the sun does, like sunspots, solar lentigines, brown spots, those can be addressed not with an RF microneedling, but with Cosmetic or with treatments like IPL if you're a good candidate based on skin type. Things like Aerolase are also really good for evening out pigmentation. So that's a different concern. This RF microneedling is better for textural issues or things that are deep in the skin. So another interesting thing, we've done this whole treatment, we only have one tiny little spot of blood. It means that the depth that we have, 3 millimeters, it's enough to reach that papillary layer of the dermis where you do get some blood return every now and again. But it goes to show this is not a super intense treatment as far as downtime goes. Typically the downtime is considered 2 to 3 days, so it's very minimal. I would say that initially, the day of, you're hot, you're red, a little bit swollen, as you can see. By the next day, you're really not red or swollen, but you see these little needle pokes in the skin. They kind of left little poke marks. They'll turn to baby scabs and just feel sandy on the skin. Unless it was a big event, it's not something I feel you need to take away from work for. You can put a little tinted sunscreen or makeup over it and cover it just fine. Doing okay? You need a break? Doing good? Cool. Our ProNox is working out for us. So it's a great treatment. Low downtime. Any other questions?
How does this differ from Morpheus 8?
Good question. So Fractora came first, Morpheus 8 came second. They're made by the same company, they are the same technology, and they actually can hit the same energy levels. The difference is that Morpheus 8 has adjustable tips. So on this tip, the needles are a set depth, and with Morpheus, you can target the periorbital depth where it's more shallow. You can treat at the facial depth or treat body. And so you are getting a thermal effect of about 4 millimeters as opposed to being maybe 4 or 5 millimeters with Morpheus 8 for the body, whereas with Fractora, you're set to 3 and it's the same all over. The other difference is that with Fractora, it's manually inserted into the skin, and Morpheus 8 is a propelled mechanism. So small differences, both phenomenal treatments. We use Morpheus we use it definitely for the face, but more so for the body because it goes deeper. We're almost done here. You're doing great.
And you did this over TCA Cross. What percentage did you use?
We use 70 for her. She does well with it. She's also going to be applying Cosmetic. In a darker skin type, we would use a lower percent of the acid because it does get very irritating and inflammatory in the skin. I'm going to go a little bit lower. But for her, she was well with 70. Her skin is still fairly light. And we are also going to be applying Cosmetic. So I call Cosmetic the safety net or the insurance policy. It's so great to add on top of treatments where you're worried for certain patients who have a skin type or an ethnicity that may be more prone to pigmentation. You can use it directly on top of certain lasers or certain treatments to ensure that you don't get that rebound hyperpigmentation. Go ahead and turn this way. Look at the top part of your lip here. So it is a great thing to do, and to me, I know that she's not going to pigment because we do that, and she has never in the past. On top of the nose. So the other thing I love about this treatment, it's very good for active acne. The heat and the energy will shrink it down almost instantly. So that's pretty incredible. It's great treatment for any patients who don't want to be on medications that are systemic but have severe acne. They actually studied this in comparison to things like Accutane, and the reduction in oil glands was very comparable. So it's a very good treatment to have in your back pocket for patients who aren't inclined to take medications. And radio frequency is just a great wavelength. It's perfect to address a number of issues in the skin. So we definitely love that. Let's see one more here. All right, looks good, so we can check. Everything is very consistent. I'm sure she's getting a little warm to the touch. So the next step here is we're going to cool the skin with some ice packs. I like to take the heat out of it. Removing the heat from skin immediately after treatments decreases downtime by a lot. So we're going to do that. Feel good? Mm-hmm. Perfect. And then after that, we'll touch base when we apply Cosmetic. Thanks for watching. Send me any questions you have. Bye, everyone.